Hi, I'm Gary Bebow, CEO of White River Health System, and this is my November CEO Connection. During the week of November 9th to the 15th is National Practitioners Week, and we get the opportunity to recognize some of the APNs that are so important to our system. With me today is Kim Watson, who's an APRN at our Melbourne clinic, and Robin Kerr, who is an APRN at White River Medical Center Family Practice, which was previously the practice of Dr. Dennis Davidson, who retired at the end of September. So I invited them to come today just to talk a little bit about what the APRNs are all about, and just give us some feedback on that. So I thought maybe I'd first start with Kim, and Kim's been with us some 3 years, worked in Melbourne for all that time, and I can tell you from me personally, boy, we are just so blessed to have Kim as part of the staff. She's been just really a savior for us in the Melbourne area, and anecdotally, I hear so many very favorable comments about Kim and the practice that she has there. So Kim, why don't you just start off and talk us a little bit about your practice down there, and well, what's it like being an APRN, and why don't you put in some plugs for your profession?
I'm at the Melbourne Medical Clinic, and our hours are 7 a.m. to 5 p.m. And I've been there for the past 3 years. Actually, I've been a nurse practitioner in Melbourne for the last 12 years. And I started out working with the health department when I was a registered nurse, and did a lot with women's health, child care, and saw that there was a big need for medical providers in rural areas, especially in Melbourne. And so that's what kind of led me into being a nurse practitioner. And I'm certified as family, so I see everyone from pediatrics to geriatrics.
Mm-hmm. And you have your prescriptive authority. You can prescribe up to what levels of medications?
We do schedule 3, 4, and 5.
Mm-hmm. And does you have a collaborating physician
Yes.
that oversees your
Mm-hmm.
records? What's that? Is that Dr. Burns that does that?
Yes, we have a certain, our scope of practice is set by the Arkansas State Board of Nursing.
Mm-hmm.
And then we have a collaborative agreement with Dr. Terry Burns.
Mm-hmm. And so Dr. Burns comes and reviews your charts every 4 hours every week or so.
Yes.
Is there a certain percentage of charts he's got to
At
look
least
at?
about 10%.
About 10%.
Mm-hmm.
Well, I really appreciate the work you do down there. You work with Naomi Miller, don't
Yes.
you, down there? And
Yes.
she came to work with us the same time as you did as well.
Yes.
Yeah. Well, you two have practiced a long time in that area, and I know you have a great following, so thanks for being part of us.
Thank you.
More recently, we have Robin Kerr that joined us, and frankly, she just started us recently, as I said earlier, to take over Dr. Dennis Davidson's practice. So Robin, talk to us a little bit about your background, and I think we talked earlier that you've been APRN for about 3 years.
5 years.
5 years.
5 years. Uh-huh.
And previous was an employee at the hospital. So why don't you talk a little bit about what you're up to?
We opened White River Family Practice Clinic on October the 1st. Started seeing patients last week, and so we're seeing patients daily over in the clinic. Our hours are 7 a.m. to 5:30 p.m. Monday through Thursday. And then most of the staff is off on Friday, except we do have one front office person that's there half a day to answer the phone and take messages and that sort of thing.
What kind of patients do you like to see?
I'm family practice, so see pediatric patients all the way to geriatric patients. So
You see old men like me as well as young kids too? Well,
sure.
That's comforting to know. So anything about your professions that you like everybody to know that you might want to talk about?
Just there's usually a lot of questions about nurse practitioners, and nurse practitioners are master's prepared registered nurses who've gone on for a master's degree and sometimes even a doctorate degree. There's a doctorate degree available now for a doctor of nursing practice. And we are board certified. We do have to take a test, usually through the American Association of Nurse Practitioners or the National Credentialing Center.
You know, I've been the CEO of the system for, I guess, about 25 years. And boy, over the 25 years, nurse practitioners have really become a vital, vibrant part of the medical care system providers. And I think it's a real tribute to the work that folks like you always have done to make sure that that reputation has been created. So thanks for working with us, and I look forward to working with you for a long time in the future. So thanks for coming with me today.
Thank you.
At the end of September, we rolled out our new standard of behavior, PRIDE. The second letter of PRIDE is respect. And during this month, we want to focus on respect, which another way of saying is we want to treat others just like how we want them to treat us. The sort of the golden rule, if you will. So during this month, let's create an environment where we respect our coworkers, patients, visitors, and let's make sure that we're very respectful of them, each other, and ourselves during this month. For November, we have 2 employees of the month, one at Stone County Medical Center, Heather Lancaster, which is out of the laboratory there, and she's been with us for some 10 years. At White River Medical Center, Jamie Smotherman from the Tumor Register is our employee of the month. Jamie has been with us for 5 years, and both of them really are outstanding employees, and I hope if you'll see them that you'll recognize them for everything they do to make White River Medical Center and Stone County Medical Center better places. We got some new physicians joining us in November. Dr. Anthony Abraham, a doctor of osteopathic medicine, will join us in general surgery. He'll be practicing with Dr. John Lambert at Batesville Surgery. Dr. Abraham has graduated from his residency about a year ago, and so we're really fortunate to have him join us and looking forward to it. Dr. Jason Knott is a doctor of osteopathic medicine, and he practices OBGYN, and he will be joining the Women's Clinic along with Mandy Brock, Dr. Carolyn Carlton, and Dr. David Taylor. And so we're really looking forward to having Dr. Knott join us as well. Dr. Raphael Gangway is a cardiologist who did fellowship training in electrophysiology. He'll be joining Dr. Roger Hill's practice and with Dr. Stoy. Electrophysiology is a new service we'll be offering here at White River Medical Center, and so I know all of us are really looking forward to Dr. Gangway joining us. Dr. Emilio Tirado, a general surgeon, will be joining the staff at Stone County Medical Center. We're not really quite certain right now exactly when he'll be starting, but if not in November, then in December. So we look forward to these 4 new physicians who's going to join the staff. They're really going to fill some of our unmet needs, and so please join me in welcoming them to the staff. I'm pleased to announce that effective October 4th, the surgeons of Batesville Surgery has joined our employment. Those doctors specifically is Dr. Emery and Dr. Brown, urologists, and Dr. Rummans, ENT, and Dr. J. Jeffrey, general surgery. They've been independent physicians over the years, and so we're really looking forward to having them come on board. And as one of the future CEO connections, we'll talk more with them about the reasons for them joining us, and just talk about some of the things that we can achieve working closer together. So stay tuned for that coming in the future. On November 10th, Dr. Singh will be our featured speaker at our community education series. He's a rheumatologist, and he'll be talking about arthritis at noon in the conference center. And so if you're available that day, come on over and hear what Dr. Singh has to say, and welcome to the staff. On November 5th through the 7th, we have our annual employee benefits fair in the conference rooms. That's everyone's opportunity to come and learn more about the benefits that we offer here at White River Medical Center. And I hope that you'll take some time to come down and learn more about those benefits. You know, they're a very important part of our total compensation package, and it's really important for all of you to get to know what they are and take advantage of them. This concludes my November CEO Connection. I hope you have a great holiday season, and thanks for everything you do to make the hospital better. If you have any suggestions, be sure to let us know, and have a great day.